it's not to disenfranchise anyone else, but to center us. We have gone through this, we know what's happening, and we have the tools to address this, particularly within the Association of Black Psychologists, other Black scholars across the groups I just spoke to. So this is the leverage that we want to say as we go to the next slide, please.
Ms. Jackson, can you wrap up?
Yes, just
wrap up the comment.
Absolutely. Okay, so many of the scholars, these are unsung scholars who paved the way. This is just a short list. There's many, many more. These are the types of criteria that can be used for what reparations will look like. Next slide, please. And I list these here. We can go to the next one too, just for the visual representation. The scholarship is here. It does not. It just needs to be taken into a deeper dive of application. You know, how do we require mental health professions to be accountable to us and our people, both in terms of funding at the federal and state level with guidelines? How do we be very clear about lifting up the work that's already been done that's effective, but it needs to be researched and further applied at a greater level beyond the limited resources that we have. The therapist in residency program that comes out of the Bay Area chapter is a perfect example where it was very intentional in how do you train Black clinicians to provide Black psychology therapeutic services within the Black community. The feedback, just like with the EECs, well received within the communities, but again, we need more resources to expand it out. How do we build further on community-defined practices, listening to our folks, lifting up that work, centering it as we bring in other sciences, and then strategically dismantling racism in mental health services. Next slide, please. I'm going to move through very quickly. I do want to take just the last couple of minutes to really underscore this particular population as we look at the interplay between those who live with sickle cell disease, which is a chronic illness, and its implications for Blackness as well. Next slide, please. So sickle cell disease is a inherited blood disorder that both parents, of course, need to, at minimal, have trait, which means they don't have the disease, but they have the capacity to pass it on, or you can have one parent who has the disease and one parent with trait. And this is a debilitating disease that has been going on for centuries. However, here in the United States, it continues to be underserved, under-researched, and underappreciated given the complexities of the illness. Next slide, please. And it's a very multifactored, very complex disease that requires intense treatment and care, and yet it is the least attended to, if you will. And pain is one of the primary criterion here, in the way in which the structural racism shows up is the disenfranchisement, where professionals do not want to work with patients who have sickle cell disease. I've witnessed where nurses would draw straws, and whoever has the shortest straw is the one who's going to serve the patients with sickle cell disease. I've witnessed many times where they're referred to as sicklers, or they're being accused of feigning that they're in pain, even accused of wanting to have a psychosocial admission because of their wanting to be drug seeking. Next slide, please. The prevalence is real. This is here. I just want to bring attention to the work that was happening in California and how to expand it further. It is important that we bring back the comprehensive care centers to better serve this population across the lifespan. You can see that there are emerging populations who are being diagnosed with sickle cell disease, but the primary group is still people of African ancestry, and which leaves them again to the implicit bias within the healthcare industry. Next slide, please. And again, honoring the work of the Black Panthers within California who knew this then. And so we're still in the same conversation of how to increase the awareness, and both within our community, so we can make sure we understand our status, make informed decisions about reproduction, but more importantly about the quality of services that we receive, and also the care that's needed in terms of the training for the medical professionals. Next slide, please. So the healthcare disparities are real, as I've sort of tapped into a few of them. The ways in which they also show up too is that there are too many medical professionals and nurses who've only had, if anything, a page or two in their training around sickle cell disease. They're not used to working with such a patient. And so then when they show with sickle cell disease and they have a black face, they are least likely to care for them and they're more likely to present in all the healthcare disparities and implicit bias and structural racism that's well documented within the field. Next slide, I'm almost done, I promise. So in terms of reparations, when thinking about this particular group, and it flows from the previous ones, is partnering with the grassroots organizations, again, that are doing the work, giving a shout out for the Cayenne Wellness Group in Southern California, also the Sickle Cell Advisory Council in the Northern California under the leadership of Wanda Payton, and being able to, because they've put together a 10-point plan of how to dismantle some of the racism, structural racism experienced by patients in the ER. The task force should definitely invite them in to learn more about that. I've sent you the document to look at more closely. As noted here as well, the California Children's Services Standards was written in 1977. It has not been updated, and it desperately needs to. There's a disparity in terms of how insurance is done, where those who are on public assistance have very limited access. Those who are in private also have limited access. So we have to close the gap in terms of being able to ensure that all patients, all people living with sickle cell disease, who we call champions, have full access to good quality medical care, as well as access to what we call complementary alternative medicine pieces in their work. And next slide, please. And so as I close, and I want to thank you for this moment, my apologies for going over time, but I welcome questions. But at the end, I just really, as I said, want to lay the foundation, the context for the task force to continue to be bold and courageous and think more diversely in terms of how to leverage reparations and helping to target the systems that continue to perpetuate psychological, spiritual, emotional challenges within our people. Thank you.
Thank you so much, Dr. Jackson, for your incredible expert testimony. We'll hear next from Dr. Sean Utsi. And I'll just say, it's 11:09 and we have 50 minutes left for this section. And we definitely want to hear from our esteemed task force members who I'm sure have comments and insights and questions. And so I know each expert was told that they had, up to 20 minutes. And so moving forward, let's just try to stick to those guidelines. So Dr. Utsi, you are next, and you may provide your expert testimony when you're ready. Thank you.
Can you hear me? Can you hear me? Okay, thank you. I want to first thank the and the task force for inviting me to speak. I had a presentation. I think I'm waiting for the PowerPoint slide to load, but I will not be able to go by the PowerPoint slide in the interest of time, so I'll try to make this as brief as possible. But the nature of my talk, if we can go back to the first slide, the goal of my discussion or my talk was going to be to provide a model that would solidify the argument for reparations. Can you go to the first slide, please? The cover slide.
I'm sorry, this is the first slide.
Okay. Anyway, so the title of my presentation was Historical Trauma and its Intergenerational Transmission, the Tulsa Race War of 1921 as a case study. And what I was trying to do in this discussion was to make the point, the counterpoint, that it's not really that much of a stretch to make the argument that enslavement has had a psychological impact on contemporary African Americans, and there is empirical research that proves that. And so I was trying to provide a model to do that. So I'm using the Tulsa Race War as that model. So we know that that historical trauma is real, that there are several important events in the history of this country that solidify that argument. We know there have been over 5,000 African Americans lynched between 1885. We know there were over 30 major acts of ethno violence, including Tulsa, Rosewood, and other communities that were burned to the ground. African folks were were tortured and murdered. Next slide. And so it's also important to know that this is not really a thing of the past. And you don't have to watch TV or Facebook or YouTube to understand that African Americans are still the primary targets of racial violence and ethno violence. And there is a scarcity of research that examines psychological trauma in relation to racial trauma or racial violence. Next slide. The legacy of slavery, as was already mentioned in my predecessor's discussion of cultural trauma, but the legacy of slavery provides a collective lens through which African Americans see the world. And it's through this lens that we can understand the psychological harm that's been done. Next slide. Again, trauma is as that which occurs to an entire culture during the same period in a common geographical area caused by the same agency, whether it be human or natural. And so this concept of cultural trauma is really the instrument which we understand how it's transmitted across generations. Next slide. And again, I apologize for going fast, but I know we're out of time. Next slide. Here is a graph that kind of delineates how the dominant group imposes their will on the subordinate group, and the trauma that results is passed across generations through various means, as was said earlier, not just through expression, but through silence. Next slide. And so essentially, I'll just jump into the crux of my argument or discussion. Essentially, I had the opportunity to visit Tulsa, Oklahoma, the Greenwich section, about 20 years ago. About 20 years ago, the survivors of Black Wall Street were numerous. Now I think there's one survivor left. When I went, I had the opportunity to talk to 12 survivors and about 20 odd of their descendants. And so I conducted a focus group, transcribed the focus group, and began to look for themes in what they had to share about their experience. And my purpose was trying to find this common thread of trauma and resilience. Next slide. And so what I discovered in talking to the survivors of the race war is that the transmission of that trauma was primarily the function of silence. That the entire community was not only silenced, but they participated in that silencing process. And when I asked people, why didn't you tell your children about what happened? They said they wanted to protect them. And so I understand, again, when we're having these so-called talks with our children, right, we are transmitting that trauma. Now, these talks are necessary because we want to keep them safe. But again, we have to understand the unique ways in which this trauma is transmitted across generations so we can begin to cease or kind of reframe how that happens. Next slide. And so again, we see that this mass racial violence, not just racial violence, but mass racial violence. I mean, from Wilmington, North Carolina, to Chicago, to Detroit, to Tulsa, to Rosewood, Florida, to St. Louis during the Red Hot Summer, was something that happened in three ways. It wasn't just the Red Hot Summer. It was post-Reconstruction, it was the Jim Crow era, and then the Red Hot Summer. So there had been waves earlier, prior to the Red Hot Summer, that happened that also resulted in mass racial violence. Next slide. Again, I can't go into all this, but it really is important. Next slide. I wanted to talk about the Trail of Tears, how Black folks got to Oklahoma. We tend to romanticize many experiences resulting from enslavement. And I know I grew up with the same narrative about being half Cherokee that many Black folks did. When I discovered that Cherokee actually owned Black people, it kind of began to reshape my vision of my identity. I'm pretty sure that my mother and father and their mother and father were trying having to explain that your light skin is a function of rape, right? And that is a consequence, as you look in the mirror every day, of the experience of African people. And so we try to dress it up, romanticize it, and make it as though there are other explanations when the evidence is in our face. Next slide. Again, next slide. Yeah, so the exact events that resulted in the Tulsa Race War are perhaps important as well, but we can't cover them now. But the point is that there's a legacy, right? That if you go to Tulsa today, you can still witness the legacy of the race riot contemporarily, although the exact events are still not known by many Tulsans or people in the Greenwood section, because the silence continues. Next slide. And even the people who were at the center of the race riot somehow disappeared and were lost from history. Dick Rowland, again, was the man they were going to lynch. And again, the important message I want to end with, although I'm having reviewed everything, but I have to end in an instance of time. The people from Tulsa, and please continue, the people from Tulsa, when I asked them what message would they like me to communicate to the world in my research, and they said that they wanted the world to know that they rebuilt. They didn't run away. They weren't afraid. They stayed and they rebuilt. And so I promised them that I would communicate that message. So inherent in the concept or the phenomena of the racial trauma experienced by the folks in Greenwood, it's important to know that resilience was at the center of that, and that despite what they faced, they were able to rebuild and come back. Again, I want to yield my time to the next speaker. And thank you. I apologize for not being able to go through it thoroughly.
Thank you, Professor Utsi, and I apologize for that. But thank you again for your incredible and thorough expert testimony. And I'm sure that we'll definitely have questions and comments and insights based on the information you provided. So next, we'll go to Dr. Joy DeGruy. Dr. Joy DeGruy, you may begin your expert testimony when you are ready. Thank you very much.
Okay, let's see. How do I get my camera on? Can you hear me? There I am. Can you hear me?
Can we see you?
You can hear me and see me. Excellent. Thank you for those who came ahead of me, Madam Chair, members of the task force. The good news is my colleagues have done such a good job, I can skip a lot of slides. But I'm kind of bringing home a different kind of perspective in terms of how I am seeing the relationship between the current mental health status of people of African descent here in America, African Americans, and American chattel slavery. There seems to be a difficulty for people to see that connection. I have a difficulty not seeing that connection. So part of this is going to really trying to bring home those connections. And the first thing I wanted to say is that there's a bit of mythology around the whole idea of slavery. So what happened after slavery officially ended? Well, the first thing that happened is it didn't. Okay, it was peonage, the unlawful selling of people back into slavery. And this lasted, of course, until 1945. Then after that, you had black codes, sundown laws, and exclusionary acts. So everybody was free, but you better not come here. And those sundown laws and sundown towns exist right now. Jena, Louisiana was one of those places when we heard about the Jena 6. And of course, that ended in 1867. Then you had the convict leasing. Well, we got to have a slave labor force. So this is where disproportionality happened. We want to know where that happened. How is it we disproportionately have all these black folks in prison? Well, they had to change the rules. And so now we're going to lease them out. In order to lease them, we have to hold them accountable for something. So now we're going to charge them things like vagrancy, startling a white woman, looking menacingly at a white woman. 15 years, 25% died under convict lease. Then following convict lease, we had Jim Crow, separate but equal. Well, it's always been separate. Matter of fact, it's still separate, but it's never been equal. Because everyone here knows wherever you are, where the hood is, right? And you know what defines the hood. You know when you cross that border and you stop seeing banks and you see check cashing places. You get my drift. So then we had, along with that Jim Crow segregation, we had anti-blackness and racial terrorism. We had lynchings, we had beatings, we had, well, everything we see today. And then we had the Civil Rights Act. Great. What continued was anti-blackness and racial terrorism. And from that, we have something called serial forced displacement, starting with slavery being displaced from Africa, followed by, Jim Crow. And then we started naming it different things because that wasn't pleasant. It created cognitive dissonance. So people needed to get new names. So we called it redlining. Wasn't quite nice, but wasn't as bad as some of the other stuff. And then after that, we said, well, urban renewal. And then it became curing urban blight. And now we have gentrification. That is serial forced displacement. Guess what the literature and data says happens when you displace people over and over again? It results in interpersonal and structural violence. So you break my leg and then you complain that I limp. Let's look at the second slide, actually. So when we start looking at slavery, and I'll be able to fold this in, we have people like Thomas Jefferson that make statements like Black people were, of course, physically unattractive, a little inconsistent with his behavior. We required less sleep. We were dumb, we were cowardly, and incapable of feeling grief. Stay with me. He's saying that, 1800s, this is when these things are being said. And more importantly, he's saying it, which means now I'm going to export it to the rest of the world. So he exported anti-Blackness and racism and dehumanization. But now let's fast forward. Those myths about who we are show up right now. This is a survey of 222 medical students and residents. And this is from publishings from the Proceedings of the National Academy of Sciences. They showed half of them endorse at least one myth about physiological differences between Black people and white people, including that Black people's nerve endings, and this also goes back to J. Marion Sims. I'm not going to cover those slides because I'm sure you've heard a great deal about him, that Black people's nerve endings are less sensitive than white people's. And when asked to imagine how much pain white or Black patients experience in hypothetical situations, the medical students and residents insisted that Black people felt less pain. This made providers less likely to recommend appropriate treatment. So now we are seeing in contemporary society, this belief persists and it causes injury, mentally, emotionally, physically, to Black people. Next slide should be slide 12 or slide 11. Go to slide 11. I'm sorry. Next slide. Okay, so let's just start with this. Can you play this?
Yes, just one moment.
Okay. And what I want to say about this is when we start looking at the impact these things have on contemporary society, these beliefs, along with the idea that, our children, simply don't feel or experience on the same level as others.
Caught on camera, a 4-year-old little girl assaulted by a teacher who was supposed to be caring for her.
2 former employees at a local daycare are facing charges after being accused of mistreating the child. Local 12's Jenna Cisneros joins us live in Fairfield outside Wild Kingdom Early Learning Center. Jenna, first off, how is the little girl?
Yeah, I spoke with the mother of the little girl, and thankfully she's been doing well. Her mom says that she is nonverbal, and staff describes her as a gentle soul who wouldn't hurt anybody. The director says as soon as she heard that little girl's cry, she says her motherly instinct came to life, and she knew something was immediately wrong.
Good morning to you, good morning to you.
What appears to be a seemingly normal start for this preschool classroom quickly turned chaotic.
Get out of here.
Former teacher James Cialino had been watching 10 kids in his class back in June when a 4-year-old girl left the room with another class. Jennifer Miller, the teacher of the other class, brings the child back into Cialino's classroom, and then he pushes her to the ground. Miller watched it all happen and proceeds to shut the door and leave.
The video itself has all the truth it needs in it. So as soon as you watch that or as soon as you see that, you know immediately what has to be done.
Director Lisa McMillian says a third teacher, seen in the red shirt, came into the classroom after the little girl got pushed to the ground. That teacher was not involved in this incident. Cialino then took the little girl to McMillian's office.
You just know something is not right with that cry. As a mom, you know when something is not right. As a director, I know all of those children and I know how they cry.
McMillian says she immediately pulled the surveillance video, fired the 2 teachers, reported the incident to police, as well as the little girl's family.
what the hell is this? I cried. I couldn't hold it. It was so heartbroken.
3 months later, the family.
Okay, so what's important here, and again, it's pretty straightforward, but at the same time, what we're looking at, this is 2021. Okay, so I'm wondering right now, what didn't the cameras catch? What is going on and what is happening? Now, there's a slide. I want you to pull the slide up on stress and children and learning. You know, I think we have the wrong slides, but no, it's actually stress. It's the name of it is stress and children. Okay, that's okay. I will, yeah, I had two. No, that's okay. That's all right. Just stay right there. I have the slide over here. I will read it. Stress and learning. And I want to say this because we need to appreciate the implications of institutionalized and continuing perpetual racism that started with dehumanizing us on the front end. The remarkable growth and development of the neural cortex during the earliest years of life can only occur when a child feels emotionally secure and warm, stable relationships. When young children are stressed, fearful, or insecure, the limbic emotional area of the brain actually prevents learning from occurring. Stress. Here we're looking at a 4-year-old that is nonverbal, that cannot even defend herself, even if she was able to. And, you know, there's this idea that, you know, again, just send them on in. We know that based on a 2016 study from the Yale Child Study Center, we know that they looked at, what was it, 136 teachers, and they had these preschool teachers look at a classroom and determine whether or not there were potential problems. Well, of course, the actual reality was there were no problems in this classroom. But instead of watching the teachers what buttons they pushed, they watched the trajectory of their gaze to determine who they looked at when they thought there was going to be a problem. And predictably, just as we see the expulsion of 4-year-olds and 3-year-olds, they looked at Black boys. They looked at them more. And even when 2 children were off task and there was a white child, a Black child, they didn't see the white child. They saw the Black child. Now, next slide. And this next presentation, I think, is just a picture of a classroom. You might have heard of this. Again, 2021. This is in Roswell, Georgia. And I want to unpack this for you developmentally, what's going on in this room. First of all the children in this room are innocent. What these parents captured when they decided to look in at their children, they noticed when they looked in to see what their child was doing, that all the white children have food in front of them and none of the Black children do. So there's learning going on here. The learning for the white children is that we're special. We don't quite know why, but we know we're more special than them. Now, what's interesting about this captured picture, which went viral, is another children told their parents. Now, let's get into the psyche of the Black children and to determine what's going on in their little minds as we see them harmed in this way. Okay, so what happens is a child internalizes shame, fear, guilt. We're bad. None of this is articulated, not even to their parents, but it's internalized. And then we want to know why Johnny can't read. And so for me, what I do, Joy DeGruy Publications, and with the models that I've written, all the things that you heard, is I put into the hands of parents data. So here's what I don't do. What every Black parent does is they take their little kids, they send them into the classroom, and they hope you're not going to hurt them. They hope that they're not going to do to you what they did to me. Like my high school guidance counselor told me I wasn't college material, middle-aged white woman. Didn't bother me or my family, but I can imagine how many other people she poisoned through her career. But she gets to be in these institutions where she does harm. So when I tell parents, when you send them in the classroom, I don't send them in hope, because I got skin in the game. So I go to my grandchildren's schools. I will train for free. But one of the things that I do with each classroom, when I walk in and there is a white teacher that is teaching my grandson or my granddaughter, I'm going to say, hello. I want to know what you're going to do to mitigate any potential harm as a result of implicit bias. And they may respond to me by going, oh, what do you mean? Well, here's some data. I want you to have that. Now that you've read it, I need to know what you're going to do to mitigate. Well, I'm not a racist. Here's some more data you might not know. But what I have to do is lean into the direction of the most vulnerable. And I have to say, you being a nice person has nothing to do with this. I have 300 years of history. So there's two things that reparations needs to do, and it's been stated already. First is you got to stop breaking my leg if you expect me to heal from the injury. And two, we have to build and create an environment so our children don't have to come home every day and say, my teacher doesn't like me. And like I said, there's what's caught on film, and then there's what we don't see. And so, there's an African proverb, and the African proverb says, when you pray, go ahead and pray, because we should pray, but move your feet. There has to be accountability, there has to be action, there has to be protection of the most vulnerable among us. And that's not happening. And these systems, again, I'm not talking about what happened way back there, but you see, this is fueled by every major institution in America. At its foundation is white supremacy. I don't care if you're an architect, I don't care if you're a doctor, I don't care if you're a psychologist. What has been breastfed into American systems is white supremacy. We cannot pretend we don't know that. We cannot send our children, our youth, our men, our women, our girls, we cannot send them out into a world that is hostile with no armor. And so part of what my work is about is giving people the language, learning to lean in, learning that when your stomach is in knots, when you walk into the school to support your children, I help them understand where those knots came from. And I want to show this last film, and then I will wrap up. There should be actually one more. It's kind of strange little.
The daycare worker under arrest in Pennsylvania. Difficult video allegedly showing her push a 4-year-old girl down a flight of stairs. Authorities say she then notices the camera above her. Here's ABC's Lindsay Janis.
This disturbing video shows a 4-year-old girl apparently being shoved down the stairs at a Philadelphia area daycare. The worker then appears to notice the camera. At that point, she holds the little girl's hand and walks her down the remaining steps.
The little girl, she just was really shaken up. She was just like, and I'm like, her eyes literally were like, help me.
That daycare manager happened to be watching on a new camera that had just been installed a half hour earlier.
So I went and confronted her at the bottom of the stairs. What are you doing? We don't do this to children.
The little girl wasn't seriously injured, but the daycare worker, Sarah Gable, was immediately fired.
You can stop the video. So again, I want to close by saying, when we start looking at how we make things right, this is not optional for me. Okay, this is not optional. People can't see the connection. Again, I say I cannot not see the connection. When we start looking at stress, remember, stress inhibits the ability to learn. Someone else talked about cortisol. So these are things that we need to lean into as people, as human beings, if we expect change to happen. And change is going to happen when we insist upon it and we put laws behind it. So I'm 100% for and with reparations, because we need to repair mentally, emotionally, and spiritually in order to change the trajectory for our children. Thank you so much.
Thank you so much, Dr. DeGroy, for that dynamic expert testimony. So now we will go to Dr. Christy Haggins. Dr. Higgins, you are available.
All right. Give me just a moment. I have a PowerPoint to share. I think I'm going to be able to do this. Sorry, y'all. Am I in this moment? Here we go. Are you able to see my PowerPoint?
Yes. Yes,
okay.
We do.
I can no longer see myself, and so I will trust that you can see and hear me now that you've confirmed that. So thank you for this opportunity to speak with you today. I wanted to just acknowledge that I am affiliated with the Association of Black Psychologists, the president of our Greater Sacramento chapter. I'm also the president and one of the founding members of Safe Black Space. It's from that place that I am going to be speaking with you today, along with other experiences that I have. I want to start by just acknowledging that we have problems. My colleagues have done a fantastic job, so I'll be able to move through some of my slides probably pretty quickly. But we have problems that are deep, long, and structural within the United States, and it's things that we cannot deny. When I think about reparations, just in terms of acknowledging where I'm sitting around this, it's connected to this broad understanding of the history that we have experienced, the wrongs, the harms that have already been addressed, that Black people have experienced for hundreds of years by no fault of our own, and understanding that that legacy of enslavement, it still is present with us. And so reparations are about how do we correct those harms, knowing that they are still present for us in contemporary times. We also want to acknowledge that the harm didn't end just because the enslavement process did for us. We know that disparities continue to be prevalent in our experience, and that we are at the bottom of every quote unquote bad list when we really take a hard look at what's happening within our country. Enola shared this earlier, this quote around somebody told a lie one day, and I'm going to just show this brief video. I'm sure people are familiar with it, but just to re-ground us in what Reverend Dr. King shared, over 50 years ago, and what is still present for us. Queenie, I think you were going to be able to share that video.
I come here tonight and plead with you. Believe in yourself and believe that you're somebody. And as I said to a group last night, nobody else can do this for us. No document can do this for us. No Lincolnian Emancipation Proclamation can do this for us. No Kennisonian or Johnsonian Civil Rights Bill can do this for us. If the Negro is to be free, he must move down into the inner resources of his own soul and sign with a pen and ink of self-assertive manhood his own Emancipation Proclamation. Don't let anybody take your manhood. Be proud of our heritage. As somebody said earlier tonight, we don't have anything to be ashamed of. Somebody told a lie one day. They couched it in language. They made everything black, ugly, and evil. Look in your dictionary and see the synonyms of the word black. There's always something degrading and low and sinister. Look at the word white. It's always something pure, high, and clean. But I want to get the language right tonight. I want to get the language so right that everybody here will cry out, yes, I'm black, I'm proud of it, I'm black and beautiful.
Yes, yes, yes. Right? What if we were able to engage with that sense of loving ourselves and understanding this story, this lie, this narrative that has been told about us, about our history, and about who we are, right? Again, a little bit of checking in about some of the history that we already know about, but Alice Walker has a quote that says, "Healing begins where the wound was made." And part of this story is us redefining the story of who we are in that narrative, but also being willing and looking at all of the wounds that have been a result of our enslavement process. And we see, right, the manifestations of this anti-Blackness throughout our experience of chattel slavery. This was referred to earlier, but this idea of the psychology of oppression, that there has been a very intentional method to use that lie and that story about our inhumanity and ways in which it has impacted us and the ways in which we connect and interact with each other, historically as well as presently, right? So understanding all of the things that were taken from us in terms of our language, our values, our families, and the elevation, instead of our experience, of the European, the white, the colonizers' experience. And in doing that, the ways in which we may have internalized that messaging, created this experience of divide and conquer, with us not being able to come together. And then realizing that this is our history, right? As the United States, that 40 of the 56 signers of the Declaration of Independence owned slaves, that 10 of the first 12 presidents owned slaves, that we were not considered a full person, and that this is the legacy from which we have emerged. We know that systemic racism, institutional racism, is grounded in this hierarchy of white supremacy, this belief that the white race is advanced and more advanced and superior than Black folks. And that has been baked into everything and every institution. Right, it's all kind of boils down to these beliefs and the ways in which institutions continue to carry forth these belief systems. And that steam, some of that smoke that's coming off is still wafting present in our lives. As we consider our history, this has been well covered by some of the other presenters, but just acknowledging what we have been through the enslavement, the chattel enslavement process, the terrorism that we experienced through Jim Crowism, in addition to the things that we are experiencing even now, right? The school to prison pipeline, police brutality, and then of course, COVID-19. We understand that racism is a pandemic too. My colleague, Dr. Jackson, talked about this as well, but how it is a virus and it is making us sick. We often are aware of post-traumatic stress disorder, those of us who work in the mental health field, but the layperson is very familiar with this term of PTSD, right? We experience something or have had a serious threat to our lives, and we can manifest symptoms of PTSD. We're very familiar with that, right? And part of what we are discussing today is the understanding that trauma is experienced as well because of the historical anti-Blackness in our lives. This image may be, again, something that folks are familiar with, have seen before, but just to note, we see in 1814 an enslaved person likely being, it's actually from the Legacy Museum, but an image of an enslaved man potentially being kidnapped and trafficked from his homeland. In 1914, we see an image of a man being lynched. And then in 2014, it's the chalk outline of our brother Michael Brown. And so the insidious nature is that this is persistent, showing up perhaps in different ways than what it was in 1814. My esteemed colleague, Dr. Joy DeGruy, who just presented, has work as well as Naeem Akbar and others, but who talk about this concept of, rather than PTSD, post-traumatic slave syndrome. The understanding that because of the hundreds of years of our chattel enslavement, that has resulted in different ways that we have learned as Black people to adapt, and ways in which are not helpful, that are harmful to us. It leaves us as well with this idea that there's nothing post about our experiences, as others have highlighted, that our experiences of racial stress and trauma and racism are constant, persistent, and leaves us frequently questioning, am I next? Am I next in whatever capacity that abuse or that racism or perhaps death may occur? And it's me personally, but perhaps my loved ones, my family members, and the idea as well of how intergenerationally the messages, the experiences within our bodies even continues. Dr. Erlinger Turner has a specific definition of Black racial trauma. He describes it as experiencing psychological symptoms, anxiety, hypervigilance to threat, or lack of hopefulness, right, about the future because of repeatedly being exposed to racism, discrimination. And again, it can be something that directly has happened to me or something I witnessed, things that we see on social media. And so the impact can be present in our lives because of all the things that we are seeing and witnessing. We also know that the symptoms of trauma can be experienced with us as individuals, right? The ways in which we see symptoms of trauma showing up in our lives, nightmares, addictions, hopelessness, numbing ourselves out, insomnia. I'll share with you in a bit a little bit of my experience with Black racial trauma. But we also have to understand that there is this collective, historical, intergenerational experience as well. What I want to offer as I continue is I really appreciate the presentations and the slides provided by previously, and hope that you can also appreciate just a more community-based level of looking or thinking about some of these issues as well, right? Being able to see the impact of this trauma. I mentioned at the beginning that I'm one of the founding members and the president of Safe Black Space. It's an organization, a nonprofit that is based out of Sacramento in California that really grew out of the killing of Stephon Clark here a few years ago. We emerged, I frequently called the emotional emancipation circles, kind of were the grandbabies, or we emerged out of some of that work. But related to that, we do community healing circles for Black folks, designed to have us understand some of the impacts of Black racial trauma and to help heal ourselves through this process. We ask a question at the end or in the middle of each of our circles, and one of the questions we ask is, how are you feeling about racism, about Black racial trauma? And you see here just a configuration of some of the feedback that we've heard from our participants. I know what stands out for me, big and bold right there, is sick, right? We see sick, confused, angry, mad, bruised, drained, anxious, defeated, many of the other things you may be able to make out for yourself. But the experiences that we have real, they are fresh, they're very present in our lives as Black people. I wanted to just take a moment and to share a little bit about my experience with racial trauma. I mentioned that I do work here in Sacramento, which evolved out of the killing of Stephon Clark by the Sacramento police a few years ago. But I really have been doing this work for a long time, and was doing work with the Association of Black Psychologists and Community Healing Network, related to helping folks across the state of California get trained on the emotional emancipation circles. It was during that period of time, you all may remember, in 2016 summer, when Philando Castile and Alton Sterling were killed like back to back. And for me, it was completely overwhelming. There were just a few days at a time. I couldn't sleep, I couldn't eat, I couldn't concentrate. And literally, I was having early morning awakenings for 2-3 days in a row. On about the third day, so that means I'm waking up at like 4 a.m, can't get back to sleep. I decide I'm going to get up, right? This is ridiculous. And in that getting up and just opening to what I was experiencing, it was this extreme outpouring of grief. I cried and cried, I bawled, I wailed. I was tapping into the unresolved grief for myself, but I believe all of our ancestors and those who have passed or been killed or impacted by trauma that we have experienced. I literally could not go to work. I had to call in sick, or in reality, I called in Black, right? As a result of being Black in white America and experiencing these things. When I finally stopped, maybe midway through the day, I had this memory, this understanding of a Tongan quote that says, warriors cry to heal their souls, to cleanse their souls. Warriors cry to cleanse their souls. And it was at that point I stood up, I got up, found my power, and began to continue doing this work. And it's, again, not necessarily that easy, but just an understanding of how this can show up in our lives. And regardless of our backgrounds, our degrees, as a psychologist, I was experiencing my own trauma and have been re-traumatized by other experiences. I think this image is just a powerful one to consider the impact of Black racial trauma, the ways in which it can impact us within different generations, within our own household or family, regardless of our gender, that we all, and even with the videos Dr. DeGruy was showing, that as little ones, as the babies, that we can all and are impacted by situations such as these. And of course, we know social media, all the access and exposure creates an even deeper level of intensity of its impact on us. This is another just visual image of understanding at its roots how our enslavement process is historical as well as contemporary oppression and racism that we experience does impact many of the systems and the ways in which we interact, potentially even with each other, right? The intergenerational nature, it's disrupted our family systems, right? And again, rooting back to the idea that we were ripped from each other, from our homeland, and how that shows up even now in our inability sometimes to connect with each other, but definitely in our mistrust of the systems which have been abusive towards us. And then the potential impact as well of internalizing all of the messaging and how that can show up in our devaluing of ourselves, our beauty, but also potentially in violence within our communities or within our homes.
Dr. Higgins, can you take a few minutes to close?
Sure. So yes, let me move quickly. This is just a study. It was done in 2013 to 16 related to police killings and Black Americans identifying mental health. Again, I want to just acknowledge that our policing, our law enforcement emerged out of the slave patrols. And so there's a clear connection there, but this particular study looked at Black men or women, Black Americans, who had been killed within states within the past 3 months. And what they found is Black folks had more not good mental health days as a result. White people, white folks were not impacted in the same way. My colleague spoke about, it's been mentioned a few times, drapetomania, and just understanding the history of mental health and psychology, psychiatry in particular, and the idea that we were diagnosed as being quote unquote crazy as a result of our desire to be free. I also want to just note that the connections between what has happened and what is happening and its impact on our lives. We also have covered previously the trauma cycle and the importance of Sankofa, returning to what we know to be true about ourselves. I want to acknowledge that how we heal is going to be important as we do that from our own perspective. We must reclaim our dignity, our humanity, and address this trauma very directly. As has already been mentioned, there are a number of healing circles and spaces and resources that can be available to do that, but we have to do the work by us and for us and not from a more Western frame of reference. In closing, I have maybe a couple more slides. This last one is just to consider this idea of the metaphor of healing in a physical injury. That if we had been stabbed, as we might imagine this person has, multiple times and needed treatment, it would be important, and we sought treatment, let's say metaphorically, right, at a hospital setting. It would be important for us to get the treatment that we need, and it may come in lots of different forms, right? We may need a surgeon to repair ligaments that have been torn. We might need a nurse to attend to our care. We may need a pharmacist to provide medication for us, a psychologist to do therapy. It's an all-inclusive process for us. And when we think about reparations, that's what it should look like as well. The mental health and healing perspective is key. And coming from that, from an African-centered perspective in particular that's culturally relevant, that hits the individual as well as a community, in addition to systems, is critical. Land transference, housing, financial restitution, all of those are additional opportunities to treat these wounds. And then, of course, considering the compensation, how might we consider that based on the history and the wrongs? In closing, regardless of however this unfolds, I have hope and trust that reparations that we are due will be paid in some capacity. But regardless, we have got to take care of and love on each other. That is where the medicine truly lies in our healing. In closing, I believe that reparations should be targeted towards descendants of non-immigrant Africans in America, folks of African ancestry in the U.S., because we know the injury is real. We've talked about that history extensively. And this idea that to not provide reparations would indeed perpetuate this belief, this narrative, this story, the lie that Black people are not human nor worthy. And I'll close with this quote and encourage each one of us to take this into consideration from Nelson Mandela. To be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others. And with that, I will concede. Thank you.
Thank you so much, Dr. Hagans, for that incredibly moving and thoughtful expert testimony. And thank you for also including some personal testimony as it relates to racial trauma as well. Thank you for that. And so definitely last but not least, we have Dr. Stevenson. Dr. Stevenson, thank you so much for your patience. We're looking forward to your expert testimony, and you may begin when you're ready.
All right. How many minutes do I have? Like 4 or 5? What is it like?
Well, I was gonna say if the panelists can just stay with us for 25, 30 minutes. So you have 10 minutes.
Okay.
And then we'll do.
That's cool. All right. First, I just want to say fantastic, my colleagues, and thank you for this opportunity. And blessings to this genius on the panel, Inole Ayer, Dr. Jackson, Dr. Utsi. Good to see you again, friend, and my good friend, Dr. Groy. So good to see and feel and hear you, Dr. Hagans. I'm just not going to say and try not to say what they have said, so keep clicking. I just a few assumptions and points that I want to make out and bring out, and focus also on the notion of how do we heal, grow, and thrive. So if you can keep clicking, I'm going to, a few assumptions around the world is socializing us how to dodge race. That's a reality that we have to deal with, which is, I'm interested in what Dr. Utsi mentioned around racial socialization, but we got to be interested in racial encounters as much as symbols, that what happens in 2 minutes can be quite powerful, as Dr. Groy described and so, you saw in those videos. 2 minutes is a long period of time to be assaulted and to be dehumanized. And so as much as people talk about systemic change, that's important. It won't happen without relationship change. We need both. Legal remedies are important, but they won't heal emotional trauma. We need to get close and proximal. Character is not as important, but competence is. How do we notice, how well do we negotiate these racial encounters and these problems? And that should be a basic understanding of competence in every profession working with our children. But I do believe we can change racial outcomes in proximal spaces. Next slide, please. When we think about racial encounters, we think about how what Shelley Harrell's definition of what is a stressful racial encounter is when we are overwhelmed, not only with our emotions, but our body and our cognitions are all out of whack. And so when we think about healing, we think about stress, we got to think about stress influences our thoughts, our feelings, and our bodies. And if we're not tracking that, we're not able to capture the full impact, not only of the trauma, but how to heal outside of that trauma. So when we think about our work around racial literacy, which I'll describe in a second, we're thinking about what happens in a moment, in a face-to-face encounter. And a lot of the 2-minute encounters that happen in race in this society end up in disaster, if you think about it. And so many of us are focused on ideology, focused on legal approaches to race, but the trauma has to be addressed in these very small moments as much as the systemic moments. Next slide. We know that racial stress is important, but I'm going to focus you on threat, not just stress. When we think about stress, it is a sort of a different frame than threat, which is at a high level of fear. And so I would argue that over across these 3 centuries, we have been dealing with rage and threat, what Carol Anderson talks about, what Claude Steele talk about a racing mind, that when we are overwhelmed and stressed, our brains work overtime. We see some things in front of us and don't see other things. And we think about the work of William Smith around racial battle fatigue and Dr. Utsi's work around brilliant work on measurement of the perseveration and hypervigilance that we go through, adults and children who are Black, from trauma that interfere with our learning, as Dr. Groy described. And then the notion of dangerousness, being criminal, perceived as criminal and guilty, is very important biologically. Next slide. We can keep going. So part of the notion of threat changes how we think about healing, growing, and thriving. So if we can think about in those videos you saw that those were rageful, threatening reactions, that those were at higher levels of an incapacity, almost hateful, that we have to understand that how we deal with threat versus stress is very important. In some of the work, when we look at the neuroscience, some people respond to the faces of Black men and boys much like spiders and snakes. It's a primitive reaction. And unless we have strategies to understand that those primitive reactions can occur in less than 2 minutes, we're missing out. Next slide. And part of it is we know that some of Philip Goff's work is brilliant around if we compare Black boys at 10 versus white boys, they're perceived as less childlike, not innocent, and 4.5 years older. Imagine what we give up when we adultify our boys. Next slide. And the same thing out of Georgetown. Oh, this is true for not only 10-year-old boys, but 5-year-old boys. When it comes to perceiving 5-year-old boys' faces as triggering thoughts of guns and violence. Next slide. But it's also true for girls. If you look at the Girlhood Interrupted, the research out of Georgetown Law School, about even as Black and brown girls are thought of as adults, it allows folks to withhold affection and support out of the belief that they are not, in my opinion, and in Dr. Goff's opinion, they're not human. What he talks about is dehumanization. If I see you as not as you are, I'm dehumanizing you. If I add you and consider you older, I'm dehumanizing you. And in a big way, next slide, those elements can trigger threat. Dr. Groy has already talked about preschool expulsion. My good friend Walter Gilliam has done that brilliant work. And I usually ask people around the country, which grade do you think? And the only thing I'll add, next slide, most people, when I ask them, which grade do you think students of all racial groups are expelled, they pick middle school, 7th or 8th grade. And I think that's because we're all traumatized by our junior high school years. Next slide. And the reality is it's pre-K. And just to add to what Dr. Groy was describing, that pre-K students are expelled at 3 times the rate of kindergarten through 12th graders. Next slide. And those are racial disproportionate issues in which Gilliam describes the overreactions, egregious overreactions, which I would argue is threat-based behavior for 4- and 5-year-olds. Next slide. So racial stress harms our perceptions. It harms how we see Black and brown people, but it also harms our health in these ways that we could talk about, but you've already talked about it. Next slide. Next slide. So the thought about our healers. So what are we going to do about it? And some of our work around racial socialization has been found to have some very significant going up. Next slide. And I'm going to ask you to go back in a second. Most of the way we look at racial socialization, and it was mentioned by Dr. Utsi around the silence from the Tulsa folks, that in many respects, the question that we have to ask is, how do we talk to our loved ones? What are the components of healthy racial socialization, or protective or affirmative? And these are some of the elements, that we need to consider when we're talking to our children and when they're talking to us. Go back a slide. So we've learned that racial socialization can be protective, but the question is, why is it protective? And the theory that I've created suggests the reason it can be protective, talking, not silence, is because it prepares young people and adults for racial hostility by reducing the stress that often comes, the unpredictable fear or threat. If I've had some schooling and I've had some love while I'm getting that schooling about racism and the history of its horror, when I see it in front of me, I've seen this before. This is not the first time my mother, my father, my brothers told me about this. And if my stress goes down, my confidence goes up, which means I can engage instead of fight, flight, or fright these moments. Next slide. So if we look at, next slide, if we look at some of the research on this, we have benefits of racial socialization linked up the wazoo, talking to even preschoolers. There's impact around self-esteem, anger management in our work with adolescents and academic achievement. But even this, we found that parents who actually feel confident about talking to their kids about race, it also reduces their racial worries, their worries about their children being racially profiled. Can you imagine what we could do in a village if everybody was supporting each other around this effort? And what does that mean for reparations, we might ask ourselves. Next slide. So part of the notion is we know that teachers of color and white teachers in schools have significantly different reactions to racial politics in the classroom. They're less threatened by those racial encounters, and it seems it's not just race that differentiates whether a teacher is competent in a classroom. It's also, have they been racially socialized? Even white teachers who've been racially socialized are less frightened by racial conversation. Black students bringing up issues in the classroom. Very important dynamic. Next slide. So we'll go to the next slide. So in another study that Dr. Jason Collins and I have been working on, looking at students in independent, predominantly independent schools, we know that students of color who perceive their schools as threatening, that the more threatening they see the school, the more stress they experience, except when they report having some coping strategies to navigate that. The more coping strategies they have, even in a hostile environment, they are less bothered by that hostility, and in some respects have other strategies to cope academically quite well. And I want to talk about that, not about coping, but healing, growing, and thriving. Next slide. Now, this is not just true for middle schoolers. The older you get, it seems like the more coping strategies you have, the less the more you are buffered from that threatening context. And we know how schools can be. Next slide. So the conclusions is, if we're thinking about racial stress and threat, we got to think about proximal relationships and those 2 minutes that we're describing. Next slide. So we've been talking more about how do we turn racial socialization into an intervention? How do we enhance the protective, the affirmative, and the corrective parts of it? And so 3 skill sets we teach now, even to 3rd graders, on up to CEOs, is the ability to read, recast, and resolve racially stressful encounters. Next slide. Reading is this ability to see the racial elephants in the room, in the moment, in my teacher, in my friends. And do I want to say, if I see it, maybe I can do something about it. It's around interpreting accurately what's happening in those moments. Next slide. Reading is fundamental to racial literacy. Recasting or reframing is this ability to use mindfulness with the focus on healing, growing, and thriving in the moment. Next slide. And we call it CLCBE, calculate, locate, communicate, breathe, and exhale. It's a mindfulness approach to help reframe racial threats in ways that I can engage them instead of swallow them and swallow the Kool-Aid of that hate, or take everybody out in a particular way, or in simply sense, freeze. Calculate is around what am I feeling in the moment and how intense is it on a scale of 1 to 10. Locate is where in my body do I feel it, trying to make sure we get all of where that stress is affecting us. And communicate is around what am I saying to myself and what memories, what images come to the mind in those moments. You can see and say a lot to yourself. And breathing, exhaling brings oxygen to your brain so you can think and hear clearer, your peripheral vision and hearing become much more accessible, and you're a better decision maker in the process. Next slide. And resolving is how do I make a healthy decision in the moment that isn't an underreaction where I pretend that trauma didn't bother me, that moment that what somebody said didn't bother me when it did, or overreaction, and that's when I curse at everybody, the cat and the dog and the hamster, and it had nothing to do with it. Next slide. I was in a, next slide, we'll pass that. We're doing racial literacy studies now with high schoolers. We're finding a lot out about what they can take in quite quickly. It so happens, this is why I love Dr. DeGroy's work around confrontation. If you look at the research on confronting prejudice, it's very healthy in the longer run, not only for the victim, but also the perpetrator. That if you stand up, there's something healthy about healing, growing, and thriving, about calling out the harm that has been done to you, even if it's calling it to yourself. And I was in a fifth grade classroom in Chicago, and I was speaking to fifth graders at 7:30 in the morning about calculate, locate, and communicate. And before I could get to the last one, communicate, a Native American girl stood up and said, I'm angry at a 9 that I'm the only Native American girl in this school, and I can feel it located in my stomach like it's a bunch of butterflies fighting with each other, so much so that it's like they fly up into my throat and choke me. The brilliance of her and her family, the teacher, about noticing what's happening to her when she is stressed or threatened is a skill that I think all of us can learn from. Next slide. I'm going to end. So this is some of the work that the racial literacy work that we've applied to communities, and not only with teachers, but teaching barbers to be health educators for Black men between the ages of 18 to 25. We have had for 20 years now a basketball project where we help kids manage stress in the moment of hostilities on the court. We're bringing families in to teach them how to talk to their children about race, and then having the children challenge their parents about notions as well, to tell their stories and not be silent, as Dr. Utsi was describing. And other places. Next slide. We've also been influential in the work of Sesame Street, which some of you know has opened up a racial justice community focus for little kids, and that's very important. And they use some of our ideas called Breathe, Feel, and Share in that process. Next slide. And I think that might be the last one. And take-home points is we've got to pay attention to racial stress and how it affects our bodies, feelings, and thoughts. But don't forget racial threat. Racial threat is another animal. It represents and reflects the rage of white supremacy over these centuries, and it will impair our perceptions, decisions, behaviors, and relationships. Feeling threatened is human. Fight, fight, or flight. Avoiding, though, the threat, not facing it, will leave us unethical and incompetent. Racial stress is something we can see and we can do something with. Those who seek help are courageous. And this is not about blame, but it is about accountability and preparation. Next slide. There's a point in the letter from a Birmingham jail where Martin Luther King is not a preacher, he's not a prophet. All of a sudden, he turns his writing to being a parent. He says, you suddenly find your tongue twisted and your speech stammering as you seek to explain to your 6-year-old daughter why she can't go to the public amusement park that has just been advertised on television. Martin Luther King is in the moment of his writing having a stress response about how he's going to protect his own 6-year-old daughter from the onslaught of hate and white supremacy. And he goes on to say, to see tears welling up in her eyes when she is told that Funtown is closed to colored children, and see ominous clouds of inferiority beginning to form in her little mental sky. And I can think of no more noble thing that we are here for, and for reparations, is to make sure that our children do not form or do not see those ominous clouds of inferiority beginning to form in their little mental skies. And I will end on that point. Thank you.
Thank you so much, Dr. Stevenson, for that incredibly thorough expert testimony. I want to thank Dr. Ayer, Dr. Jackson, Dr. Utsi, Dr. Grui, Dr. Higgins, and of course, Dr. Stevenson for your expert testimony. I'm aware of our time, and so I take 15 minutes or less for questions and comments from our esteemed task force members so that we can end promptly at 12:30 and give enough time for folks to have lunch and reconvene. So at this time, I would like to turn to my esteemed task force members. If you all have any comments, questions, or insight based on the incredible information we just received. And I see Vice Chair Brown, you are recognized.
Thank you, Madam Chair, members of the task force. and to our expert presenters. All I have to say is that the presentations were comprehensive, scholarly, great substance, right on. But with what all they've said, it appears to me from my perspective that we just need to understand we got to give intensive care. Intensive care. And we don't have much time to prolong the business of this task force with many things that we already know. We already know. Just look at Garner Murdoch's report 80 years ago, American Dilemma. All of that is there. Look at the Kerner Commission report. It's all there. Andrew Hacker in his book, Two Nations, Divided, Hostile, and Unequal, 1996. What I'm saying is that 90% of our work is getting the body politic of this state to do something and not make this exercise, as I've said before, a paralysis of an analysis. We've had great knowledge, but the question is, do we have the will of steel? Does the Assembly and the Senate have the will of steel? Act on what the experts have already told us. It's all right to go through the process of going around the state, having hearings, but we must not make this a dog and pony show to those who would be engaged. I do not say they're disparaging, but that's what it will end up being. The patient is dying, mentally, physically. But are we going to do that which is necessary to give intensive care and declare a state of emergency on the deliverance of healing? Thank you. You know, the last thing is existential right now. What are we faced with? The disenfranchisement of the black and brown votes. You have seen it all over this country. But even in our analysis, we fail to understand that in addition to the physical brutality, the lynchings, etc., we must remember that it was on 1875 that 50 plus black people were massacred at Clinton, Mississippi, because those Democrats were mad at the Abraham Lincoln Republicans who had unified and enfranchised blacks. And how and right now we have today the redistricting, we have the voter suppression, all of these laws in 19 states, but they continue to do what they did in 1875, and that is to block us and stop us when we try to have strides toward healing and reconciliation. Thank you for hearing me, but this thing is existential for me, because also a black Baptist preacher, George Washington Lee, was the first person to be murdered, lynched, in 1955, May the 7th, because he wouldn't take his name off that voting list. And Benjamin May was right. Dr. King's spiritual and intellectual mentor, when he said in his last address to the students at Morehouse, the future will not come from the rabid segregation of the Wallace, Barnett, but it will come from the so-called progressive white liberals who will wine and dine you in the swankers of hotels and sip tea with you, but will refuse to share political and economic power with you. This reparation has to see political and economic power being granted to us so that we will, as has been stated by many of these experts, healing will begin with us uniting with our allies to deliver us. Thank you for coming after this expert on it. I just couldn't help it.
Thank you, Vice Chair Brown. Member Grills, you are recognized.
I want to thank you, Madam Chair. I want to thank our panelists today. I think you have made a compelling argument for the inclusion of some attention, substantive attention to mental health in how we are going to define the forms of reparation and reparations in this work. And I want to share the following with you. This was someone who, because I think it crystallizes what many of our panelists have said. She was actually waiting in the queue for about an hour to give public comment and had to leave to get to work. But this is what her name is, Barbara Melancon. She's a Black social worker. She's also a minister at Second Baptist. And she said, I work in hospice service with terminally ill patients who are at home. Many of my elderly Black patients are happy to see a Black social worker and share their experiences. Essentially, in the last days of her patient's life, they are sharing the following. I saw lynched 8 little boys' bodies hanging in a tree. White people are another person. White people are no good. Don't trust them, especially when they talk about the Bible. Another person said, forced to work in the field and was not allowed to go to school. Another person said, I was refused medical care during childbirth in labor. Another said, my father died from pneumonia because white doctors refused medical treatment. For many of these Black people in hospice, in the final days of their life, they're doing what Dr. Stevenson said we need to be doing for the integrity of our well-being. Shame on this society that in their final breaths, they're trying to unload the racial stress and racial trauma. And so I just want to, again, applaud the panelists for driving home that point. It will be hard for us to ignore the importance of mental health and well-being.
Thank you for that, Member Grills. I had a question for Dr. Utsi. So I also just want to apologize. I think out of all the expert panelists, I think yours was the most rushed. And again, I apologize for that. But I wanted you to just restate some of the key insights that you wanted to impart onto the task force as it pertains to the work that you do. And, the more broad question of, what can mental health reparations look like in the state of California for Black Californians?
Thank you, Madam Chair. I appreciate that. I was trying to exercise my home training and be respectful of the speakers before and after me. And so I rushed a little bit, but I don't regret that. I think what I was trying to say in a nutshell is that historically, the pushback towards reparations has been kind of an evidentiary argument that you really can't prove that there's any harm done to contemporary African Americans from slavery. And to provide a model, a framework to make the argument that we can demonstrate empirically that the trauma is transmitted across generations in these various modes. And that as a consequence, no one has done the work going back to slavery in terms of empirically, but making the association between the early 20s and the work that's been done already with the Holocaust survivors, Native American folks, we have an empirical record that says this is how it works, that the trauma is transmitted not only in silence, but in our culture, through stories, through fables, through myths, how we raise our children. Even the idea that we always boast about how well-behaved Black children are, our children are in public. We talk about how when we're out in public and we start misbehaving, Big Mama or our mother or father will give us a look and we straighten right up, right? And we juxtapose that with the white kid who's in public running amok, cursing at his mother, kicking and spitting at his mother, and we kind of take a sense of pride in that. But what happens is that white child learns that there are no boundaries, that I can push the limits as far as I can, and my mother's right there to protect me. The black child learns to keep his head low. Don't take chances, stay low, stay out of the way, be seen and not heard. Now, when they become adults, what we've done to the black child is we stifled their willingness to take risk, to push the boundaries, to explore outside the box, right? So if a black child or a black adolescent tells their mother they're going to drop out of college because they have an idea they want to pursue, we would lose our minds as a black parent, right? We think they were crazy. But a Bill Gates or Mark Zuckerberg did just that because they learned that there are no boundaries that they must respect. We've learned to be cautious, and sometimes that cautious stifles our possibility. The way that this system has worked in terms of mental health is multifaceted, not just in terms of disorder, but even ambition, right? Even creativity, the willingness to kind of understand that the possibilities are limitless. So again, I think that we need to have a broader understanding of how the transmission of this trauma affects us today, and to be able to articulate that, and if necessary, to have empirical proof that this is how it works. And so that's essentially what I was trying to say through my own work in Tulsa. And thank you, Madam Chair, for recognizing my need to say something.
Absolutely. Thank you for that. Are there any other questions, comments, insights? Senator Bradford, you're recognized.
I too just want to thank the excellent testimony heard today from all of our expert witnesses, and I think
your audio went out, Senator Bradford. Okay, as we're waiting for Senator Bradford to come back, I wanted to pose the same question to Dr. DeGruy that I posed to Dr. Utsi. If you could just reemphasize or reiterate, what reparations could look like in the mental health context, particularly for Black Californians. And then I also had a follow-up question for Dr. Hagans. There was a last point where you said, reparations should go to non-African immigrants. African non-immigrants. And so I just had a question if you could clarify how you got to that position. So Dr. DeGruy, you are you available?
I am. And first of all, I am Dr. I quote almost everybody here in my work. I'm just going to tell you, Dr. Hagans, of course, Howard Stevenson, you should be getting work coming your way. I quote you so much in positive racial socialization. I think that when I think about mental health, I think when people know better, they can do better. And what we do, and we are, the kid in the bank, and you were talking about the parents that just give that look. A stranger can give that look and the child will fall into line, because that's part of what we have done to keep ourselves, we think, safe, when at this point we're stifling each other. But I think that the more people understand it, when I talk about my work, it resonates, because I'm talking about down on the ground. I'm recognizing that this is right here. It doesn't have to be so extended in terms of transmission. There's been lots of work done around transmission. Not only that, but bringing in the concept of epigenetics and telomeres and the destruction of telomeres, which is, holds the strands of DNA together. And when you have stress and the degree of stress that we have, the cortisol, the adrenaline, and the inability to do things about that, it shortens our life expectancy. So we have transmission. We understand how it gets transmitted from generation to generation, biologically, socially, social learning theory. All of those things are really straightforward. But my sense is we've had, some of our best. I love them. They're in ivory towers. They got sucked up and they're, and God bless them. They're doing the work and keeping the lights on. But we need folks on the ground. We need boots on the ground with this. And I think that, whatever we do here, if this can't get transmitted to the folks out there that may not even have access to this, that's where I think the mental health need is. Because you see, I tell people, every single person I deal with, I said, this too shall pass. I said, and we have dealt with far worse. We have all that we need. When I think about the scholars that are here, and I know I'm dreaming, but we just need to open our own institution and make it happen. Okay, I think that is kind of what I said, my God, I wish I could, and when I do this thing, I wish I could transport with this, what a sister said yesterday when she was talking about what's going on in the cyber world, which is so not my lane, but I could hear what she was saying and I understood its need. So I guess for me, I'm always trying to look at what Howard's doing around how do we, because, I was there when you talked about play, preventing long-term anger and aggression in youth, and the impact of touch. You remember that, Howard? The impact of touch, that we are not touching our children. And he was able to reduce aggression by simply touching them.
Absolutely.
You know what I'm saying?
Yes,
that's what our people need to hear. I'm done. I feel some kind of way about stuff. And I went to Crenshaw High School, by the way, graduated from Crenshaw.
Cougar. Gardena won't hold that against you. Gardena won't hold that against you. My sister went to Crenshaw because she was on that high school tour, kicked out.
Senator Bradford, you can go ahead.
Oh, yeah, I just want to say this is just powerful. And I think if there's the connective tissue from slavery all the way to where we are today, it is the mental and the psychological abuse that African Americans are still dealing with today. And I think it's having far greater impact than the economics, the education. It all stems to our psychological worth. And I think that's so impactful and we need to deal with it. And I just want to also echo what Reverend Brown always states. I mean, it's always a mic drop moment. So I thank you for constantly speaking truth. And I know as Reggie Jones Sawyer and I, as the only two legislators on this commission, we're committed to moving forward with the agenda. It's a real truth of talking to our other colleagues, our progressive liberal friends who will find reasons why not to support much of what we will probably want to move forward with this commission. But we're committed to that. Thank you.
Thank you, Senator Bradford. So I know we're up over time, but I know I posed a question to Dr. Higgins, and feel free to answer.
Yeah, I'll just respond briefly. So the point that I made was that I believe reparations should be targeted towards non-immigrant Africans in America or the U.S. So in terms of folks that are connected in terms of African ancestry within this country, I know we've had some conversation within the expert panel and the public comment section, I think, that addressed that. So that's what I was speaking to. That's where we see the connection in terms of the injury that's still relevant today. That does impact all Black people, please don't get me wrong. But really understanding as the reparations and the bill that's being proposed, I believe should be targeting non-immigrant Africans in the U.S.
Thank you very much, Dr. Higgins. So again, I would like to thank our esteemed expert witnesses, Dr. Enola Aird, Dr. Jackson, Dr. Utsi, Dr. DeGruy, Dr. Higgins, and Dr. Howard Stevenson. I'd also like to give a special thanks to Member Grills because without her input, we would not have these panels around the different sectors of health. So thank you to Member Grills. And so I know that we are over time, and we will reconvene back promptly at 1 p.m. for our panel on physical health with Dr. Kaufman, Dr. Kuzawa, Dr. Aroke, and Nkem Ndefo. So thank you again to our panelists and to the members of the public. And you can find all of these meeting materials on our website, oag.ca.gov/AB3121. And the meeting materials include all of the slides, so you can look back at your pleasure and your convenience. Okay, thank you, and we will reconvene at 1 o'clock.